Hey everyone, welcome to the Gaslit Truth Podcast. You are here with your two co-hosts, Therapist Jenn and my good bestie,
Dr. Teralyn.
Dr. T. So today she's Dr. T. Okay. So
Okay.
we've got something super exciting. We've got our very first guest that is on our podcast. And before we introduce Dr. Josh here, what we would like to do is just remind everybody that we are all over these socials. So if you have not started to follow us yet, you can find the Gaslit Truth podcast on your Instagram. We've got a Facebook. You can hit us on YouTube. Anywhere you listen to your podcasts, we are going to be there. And not to toot our horn, but we may or may not have hit like 17 in the top 100 of Apple Podcasts.
Yay, I feel like the air cannons need to go off right now.
In the life sciences category, which is pretty darn cool. All right, so
we're coming after you, APA number 5.
APA, we're coming. So anyway, so that was so wherever you listen to your podcast, make sure that you find us there. Do the things like subscribe, give us some stars, tell us what you think. We've got a ton of comments that have been coming through on our podcast, on our YouTube channel this last week, which was super cool to see. So feel free to DM us, let us know what you think. And without further ado, I will have Dr. T introduce our fancy guest today.
Very first guest. Yeah. All right. Welcome, Dr. Josh Helman, MD. He's an emergency medicine physician licensed in 14 states. Wow. Dr. Josh has 2 degrees in biochemistry, a bachelor's from Harvard, magna cum laude, and master's from the University of Cambridge in the UK. His dual medical degree is from Harvard Medical School and MIT, and he is a board certified both by the American Board of Emergency Medicine and the American Board of Lifestyle Medicine. Welcome, Dr. Josh.
Thanks. It's great to be here on your inaugural be your first guest.
Yeah. It is.
We're gonna get there.
Oh, and boy, we are hitting it hard too. Like, look at who we've got. This is just fantastic. So
Jenn is having a fangirl moment.
I am having a fangirl. I have to be honest. Last night, I said to Terry, I messaged her, Dr. Josh, and I said, "So I've never met him. I've never talked to him. I'm on his website. He's got these great blue glasses on, so it makes me feel good because I like the glasses you're wearing in your picture."
Oh yeah,
thank you.
And I said, "Does he have a sense of humor? Like, does he know he's talking to like me and I screw around a lot? Like, I feel like he might get annoyed by me." And so it was kind of, I was having a fangirl moment because I really thought things were cool with how you marry your degrees, the certifications that you have with what you are doing in real life right now with your practice, because they're kind of separate, and you went and you married 2 very opposite ideas a little bit, which is like really cool. So
so I think starting off, before we hit the meat of our podcast today, I would like to know how you got there. Because Jenn and I have our own experience of how we not necessarily turned away from traditional psychology and practice like that, but have kind of broadened our scope into other things. So I want to hear this. I want to know the real truth.
Yeah. And so I'll try to summarize it. It wasn't just one event, but I think some of it just started with my father's a physician, a gastroenterologist, who at a very early age, like I remember rounding with him when I was like 7 or 9 years old.
That's so cool.
And seeing patients who were complaining about stomach ulcers. And I remember my dad telling them, you have to stop drinking alcohol, stop the beer, stop eating the salami. And I remember these patients just not being happy. It's like, wait, I've got to give up all these, foods and drinks. And then I also, the stories that my dad told me when he was in the military and basically didn't like some of the way that some of the soldiers were being treated at Walter Reed, and just how he got kicked out of the military for standing up what was right.
Really?
I think that was internalized at a very early age. And then I was one of these nerds. You know how people like study ancient languages? Well, the ancient languages I studied were ancient Latin, ancient Greek, and biochemistry. Because I think of biochemistry as a language.
Oh, for sure it does.
and
that's a whole different level.
And I was doing that as a teenager. And the cool thing is the basic biochemistry hasn't changed much in the last 40 years. So so I've been able to use, with 2 degrees in biochemistry, I've been able to use that knowledge to basically look at all these cool new technologies, treatments, therapies that are coming up, and try to figure out, like, is this for real or is this marketing hype?
Ah,
And the reason I would say veered a little bit from the traditional path is my own personal story. A dozen years ago, I was 50 pounds overweight. I had high blood pressure and I couldn't fix myself. I'm like, this is ludicrous. I've got 2 degrees from Harvard. It's like, I'm very well educated. Why can't I figure this out myself? I better start looking at other alternatives. And I view my current practice as integrative. When you're looking to fix and even reverse a chronic disease or condition with the brain or any other organ in the body, you need, I think you should be looking wide, casting a wide net, and looking for help that way. And I would say I'm also uh, I also have a keen memory. I remember when I did my rotation in psychiatry at Harvard Medical School. So this would have been around 1990, a long time ago. I
It
remember
wasn't that long ago.
I remember one of the attendings sitting me down and saying, "Josh, you are not allowed to give someone a psychiatric diagnosis unless and until you've ruled out everything else." And
I
then
want to know
and that
Ooh.
everything else was like a long list of,
Mhm.
30, 40, 50 things. And I've remembered that, and I've held on to that, and that all those things are definitely humbling. And what's also humbling is just realizing the complexity of the human body, especially the brain. So I think all of those things have been put together for basically for me to help myself, and help current patients. And you're right, my current focus is on reversing Alzheimer's disease, which is definitely a tough condition. But when I lecture to the general public, about a third of the people say, well, Dr. Josh, we all know that there is no cure or way to reverse Alzheimer's, so you don't know what you're talking about. So
Right.
I see that people, both physicians and the general public, are kind of locked into these traditional pathways and are not open to other alternatives sometimes.
Okay, so is it fair to say that's the opposite of biohacking?
I would say that's the opposite.
Okay. Okay, so at some point you're gonna have to define that word because I got all geeked up when I saw that and what that word means for you and your practice, because that's what you're describing, right?
Exactly right. So bio just means something biologic, and yeah, we are alive. So it could refer to trying to hack our brain, or and then hacking it goes back to basic computers, where it was the hackers who actually understood the zeros and ones and the machine
Yeah.
language and
Yeah.
behind. And it's the analogy is, if you actually understand the underlying mechanisms, the root causes, the biochemistry behind what's going on in the cells, then you have a hope to try to fix
Yeah.
things. And it's also a philosophy thing of, sure, we would all like to wait until we have double blind placebo controlled studies that show that this reverses aging or fixes brain or other problems. The problem is, if you are currently have Alzheimer's or something, or prematurely aging, you don't necessarily have 50 years to wait for all these studies to sort out.
That's
So
true. I mean, that's true because time is literally of the essence in that population. I just think it's fascinating that you're not just preventing Alzheimer's, you're trying to figure out how to reverse it once you have it, or
a
you are
hundred
figuring it
percent.
out and
Yes.
reversing it, which I think is the coolest thing because it reminds me a lot. The language that you just used reminds me a lot of the language we use around mental health. Like once you are depressed or anxious or
Yeah.
ADHD or
You
whatever,
always are.
you always are, or addictions, you always have this thing. It's like a death sentence. There's
Right.
no hope here, right? Once you have it, you always have it, and you're just going to learn
Mhm.
to deal with it and die,
Right.
you
The
know?
the
Yeah.
the the so-called modern healthcare system is it's basically chronic disease management. You wait until you have a chronic condition, like
Yeah.
you mentioned, depression or anxiety, and only then will you try to address it.
Right.
And yeah.
Yeah, I like the reversing, like trying to reverse something once it's already there, because I think we don't pay too close of attention as we're leading up into a disease state, right? We don't pay it that much attention until we're there, right? So we can talk about preventative medicine all the time, which is great, but I don't think we really take action until something's there. And then you get there and you're like, oh, there's nothing except now disease management, right?
Exactly.
So, yeah, and
Yeah.
Alzheimer's is a big deal. So, I need to ask you, like, with Alzheimer's, like, what do you and if you don't know the answer to this, is totally fine. What do you see as some of the main cause of the trajectory of Alzheimer's disease or brain diseases like that increasing? What is it that you see?
Yeah, so that's a great question, Terry, and it kind of underlines like what is the underlying cause of Alzheimer's?
Mhm.
And the underlying cause it actually has between 50 and a few hundred underlying causes.
I believe
So
it.
let's talk about some of them. Obviously, I can't cover all of them in the limited time
No, I
we
would like
have.
you to cover all of them, please.
Yes,
Thank you.
yes, you must do it all right
Ready.
now.
You got 40 minutes.
Go.
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 We
So
get CEUs for this? I'll be
no,
I'll be
no
on.
question.
Okay, sorry.
Yeah,
Go
I'll see.
ahead.
So one of the causes of the underlying causes is inflammation. What causes inflammation?
Boom.
Things like underlying infections and underlying toxins. What do I mean by toxins? Things like heavy metals, petrochemicals, things
Mhm.
like PCBs, forever chemicals.
Yeah.
There are so many. The from analyzing some of the artificial intelligence, machine learning, looking at lots of
Mhm.
patients with Alzheimer's, the number one risk factor actually is poor sleep.
Oh,
So
Oh,
so
wow.
but your
I feel
question,
called out. Anyway,
yeah,
go
yeah,
ahead.
your question is like why is it increasing? I think one of the sources is got to be our diet in terms of much people are eating much more processed foods
Yeah.
which have built-in toxins
Mhm.
and processed foods don't have the nutrients, the antioxidants that you're going to find in whole foods like whole fruits and whole vegetables. So I
Right.
think one piece of it is just our diet got worse. The next piece is our toxin levels have gone up. These fatty toxins, forever chemicals, plastics. If you look a few generations ago, people weren't eating food in plastic. They weren't
Mhm.
finding huge plastic levels in their in the water, in the air, in their clothes, right? I mean, look at what
Mhm.
we're wearing. Most of us are wearing plastic clothes.
Yes.
Most of us
Mhm.
spend 90% of our time indoors. And if you look at the air quality indoors, um, often there are high levels of plastics that you're breathing in. So I think that's another piece.
Mhm.
Um, Exercise. I think, unfortunately, we're more sedentary now than we were many generations ago. So I don't think it's just one thing that we can point the finger to, but I think it's important to realize that a lot of this is lifestyle, and
Mm.
that's where I would start
Oh,
looking to try to fix and reverse this.
I feel like he just listened to the last
did you
podcast.
did you just
Yeah,
listen to our
no,
last podcast?
we
We
had
should
it
have
was on
just had you on.
inflammation.
Oh
Yeah,
my gosh.
it
It
was
was.
actually just released this week.
Oh my gosh. No, I was just thinking when you were talking, people, and I don't know if you experienced this, people don't like to hear that.
Right.
Mm-mm.
Like they want there to be some big huge other underlying issue, right? Then like, and even Terry and I mean, we have conversations in our practice. When you were talking, I was thinking about these pillars that we focus on with our patients of
Mhm.
eat, sleep, move, meditate. Those four things, right? If you can bring those into your lives, right? And people come, at least my experience is they come to me and they're like, you're literally talking to me about what I'm putting in my mouth. I came to you for therapy. And
Yes.
and they just, it's like people are wanting something so profound as a change, and it's like lifestyle change is too hard to hear versus go put this on it and that will fix it or this will help it. I don't know if
Yeah.
you get any of that, but it's just like
No,
it's
I get it personally. When a dozen years ago I was trying to fix myself, and one of the first changes, I mean, I heard all these lectures about, avoid animal products, etc., because of their higher levels of inflammation, higher levels of toxins, the higher up you go in the food chain. And I was
yeah.
like, oh, that's great information, but you know what? this is what I like to eat. So what's the least change?
Yeah.
What's the
the
minimum?
smallest thing that has the largest impact?
Yeah, like you're a therapist, but
Right.
I don't want to talk to you all the time. Like, can we condense this into like one 30-minute session? Because
Right.
I'm sure what you have to share is good, but can't you just fix me in 30 minutes? So that was my approach. It's like, what's like the one thing? And my approach was, guess what? It took many years of just picking one thing at a time. But the key was going in the right direction. So there's some people like me that it's going to take them a long time. And then there are some people where they're like, no, I'm trying to fix a big problem. And I want, you shared with me 20 things. I'll do all 20 things right now. And everyone has a different path. And I don't judge, because I know myself, it was really hard to try to make huge changes all at once. So what I would say for the people watching and listening is don't increase your stress level over this. Pick a pathway that makes sense for you. But I think that's human nature. Human nature is we're looking for the easy, the least amount of energy.
The easy button.
Yeah.
The easy
Oh,
button.
man. Yes.
Yeah.
Yeah.
Well,
which-
and I think when you had talked before about like what's the difference between what is real and what is marketing, I think marketing plays a huge role in those decisions, right? So if you market to me a pill that will fix my ill, that seems easier than, trying to figure out your sleep, right? Or what foods can I or can I not eat? Plus, there's so much information out there that's conflicting, depending upon who you're listening to. They'll say this is okay, all foods are okay, all foods are not okay, this food's okay, this food's not okay. Like, who do you listen to? That's kind of my thing. Like, who do you listen to? And that's a tough one to, I don't know, to flesh out. Like, who do you listen to, right?
Exactly right. And I think it's important for the general public to be skeptical of everyone, but what I
I
find
love
is
this guy. I think
Oh
he's
my
in
God.
our practice already. Like,
You're our third host now. Like,
exactly.
that's so sweet.
you're on like that.
You're it.
Like, I mean, you are on the podcast. The basis is we question everything and everyone's truth is different. But like,
Right.
you're getting all the buzzwords here, Dr. Josh.
No one's done better than me so far. So right.
That's right.
It's a really high bar.
That's hilarious.
But what I would say though is, what I find is that most of the information the public gets is from the media and from big food companies, big pharmaceutical companies. And what I think many people don't realize is that there can be censorship of what we're allowed to say. And you have to look between the lines, and then also look widely. Don't just look in whatever country. Don't look just in the United States. Look to the rest of the world and see what is working elsewhere too.
Which is funny because I remember writing my dissertation and them explicitly saying, do not use any studies that came out of that did not come out of the United States. And I'm like,
Seriously?
yeah, I'm
Wow.
serious. Because they didn't the research, you couldn't prove that it was real good research, right? So under our US guidelines, whatever that is, but I remember that explicitly. And I was like, at the time I was just a, measly PhD student. I was like, okay, sure. Why? Okay.
Whatever you say, yeah.
Whatever you say, I had to get this thing done. And I didn't question it because I was like, no, you're right. You're the educational institution. Like, you are right. So I have to follow these rules and do these things and live in this box. And now I realize that I didn't have to do that. Well, I did to graduate there.
Right. Or I've also heard, like, don't look at any study that's more than 10 years old or something. It's like,
yes, that too.
as if humans have changed so much, in the last many decades.
I don't think thousands of years ago they were writing research studies. Anywho, but anyway, I'd like to see that journal. It's written in stone. I don't know.
There you go.
Yes.
So
go ahead, Josh.
Yeah, Josh. So when you started this, you were talking about like these precursors or things to watch for, things that we can work on in terms of that aging brain, right? And so, we kind of like, of course, we derail because this is what we do. We'll circle back here.
Okay.
So I want to ask you. You were talking about a few different categories, like just getting it back to basics with like, what are we breathing in? What are we taking in? Are there toxins? Is there inflammation? Like, so you've got pieces with like nutrition and sleep that you're bringing in here. Okay. What about gut health? Where is that in this?
Yeah, I think gut health is fundamental because I mentioned one of the key causes of inflammation.
Mhm.
Most of the inflammation comes from exposure to bugs, and most of the bugs are present in your gut. So I also find the connection is there's a barrier between your gut, or there should be, between your gut and your bloodstream, just like there should be a barrier between your blood and your brain. But
Right.
unfortunately, I find in those who don't have a blood-brain barrier, they also don't have a good gut
Okay.
barrier either. So that's another connection.
How
that
would you know if someone didn't have a good blood-brain barrier or a good gut health barrier?
Yeah, so starting with the brain, you would look for inflammation, and what I find is you were talking about conditions like anxiety and depression. I
Mhm.
find normally in conditions like that, there is a higher level of inflammation in the brain. So that's one of the hints. Um, in terms of gut health, I mean, people will know if they're having, regular, if they have got nausea, vomiting, other problems. They're gonna know. Uh, they're gonna know. I would say.
Don't you just pop a Tums or something
Yeah,
when
then
that
I just keep
happens?
doing that. Yeah.
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 So
No.
no, the
More Pepto.
what is Tums? Tums is calcium, and oral calcium, despite what you've heard, is not good generally for bones. Is actually good for depositing extra calcium in your blood vessels, and that's one of the big risk factors for Alzheimer's and other chronic
Oh,
diseases. Is
guys, I didn't
too
even know we were gonna do this transition into this right now with Tums. I had no idea. Sorry
Here we
about
go.
that.
Go for it.
we
Yeah.
didn't plan this, but
No.
but unfortunately, you are as healthy as your blood vessels, and if you're popping things like chronically extra calcium, generally that's going to be deposited in your blood vessels, which will cause hardening of the arteries, which is not good.
Wow.
Oh.
So I just wanna hear more about the reversal of Alzheimer's and dementia and maybe how other ways that we can also protect our brain. I mean, you mentioned the pillars and things of mental health, or not mental health. We call
That's
it the
us.
4
That's
pillars of
us.
mental health,
They're
but
all the
it's really
same
just the
though,
4
which is
pillars of everything. So,
fantastic,
yeah,
which
I
is
know.
great,
Like,
right?
if everyone's
I'm not a
listening, like,
medical doctor, but shit.
I know, right? Like, I
Wow.
love it when like our message gets. I'm sorry, my
Married. Our
microphone.
messages
Yeah.
get married. Yeah, you're
Yes,
having
I'm
I don't
sorry,
know if
my
I should talk
microphone is
for
all
you because
crazy today.
I can
Yes.
see you're struggling
Sorry
here.
about
Okay,
that.
you can finish your sentence now.
Thank you.
You're
Yes.
welcome.
When they get married, my mic doesn't want me to talk.
It
All
doesn't.
right.
I don't.
Anyway, Josh, I'm just going to pass it over to you. How about
Mhm.
That's okay.
how do you reverse Alzheimer's or in your practice?
Yeah, so the reversal is basically 3 steps. We layer 3 different steps. One is what we've been talking about, lifestyle. Are you getting enough sleep? Are you putting good quality food into your mouth? Is your stress level low? Do you have good connections with people? Are you exercising? Are you meditating or praying or whatever is right for you? So that's first is the lifestyle approach. Next, I layer supplements, smart medications. I'll give you an example for that. Um, there's a genetic test called ApoE4. If you have one or two of the ApoE4 gene, you're at a much higher risk of getting Alzheimer's. But if you take higher amounts of omega-3 fatty acids, that risk goes away if you're also doing the lifestyle things.
Right.
So that's an example where if you know that you're apo E4 positive, you should be taking at least 3 grams a day of omega-3s. And then on top of that, I'm really excited about this. There's a new FDA approved drug for compassionate use that at least initially has shown some great results of reversing, this is an IV medicine, reversing Alzheimer's by decreasing inflammation. It
Oh,
doesn't
Mm.
go after the amyloid plaque directly. It goes after by decreasing the levels of inflammation. So,
Huh.
so, so, so my thinking it's you want to layer on all 3. And another point that I think is important for people out there is that, well, at least when we talk about Alzheimer's, these underlying causes, sure, there's so many causes, but the progression of the disease normally it can take 30 years for this disease to progress to get really bad. So, and in the first 20 years, people may have no knowledge that there's these underlying problems underneath. So what I would say is, don't wait until you have an issue. Try to prevent. It's a lot easier to prevent than it is to try to reverse.
Would you say that getting that genetic test would be important then in the prevention?
I would, and the reasoning is we want people, because it's actionable. It's not,
Right,
oh,
yeah.
woe is me, I have higher risk. No, it's like, okay, these are the cards I was dealt. I'm going to take these cards, and instead of being depressed about it, I'm actually going to be proactive so that it's not going to be an issue for me. Because I mean, is it fun taking omega-3s every day? No, but or eating lots of ground flax seeds? No, it's not but it's like, I can do something about it. Oh, I need to get enough sleep. Why? Because when we sleep, that's especially deep sleep, that's when our brains recharge and get rid of toxins, etc.
Yeah, and well, that's why things like alcohol and whatever disrupts your sleep is not good. Even like, so again, if you don't know the answer, it's totally fine. But I had read some research about over the counter and prescription sleep aids, um, increasing the risk for Alzheimer's and dementia and earlier death. I don't know if you know anything about that, or if you could weigh
Oh,
in on that at all.
definitely. So
Mhm.
one of the common, let's give an example, Benadryl.
Yeah.
Benadryl or other antihistamines. We know that antihistamines decrease acetylcholine, which is one of the really important neurotransmitters in the brain. So I'm not saying never take Benadryl, right? If you're having an allergic reaction, take it. But what I am saying is, like, if you need Benadryl to get to sleep every night,
Oh,
boom, that's going to increase your risk of Alzheimer's. And it's the same. It's other medications, over the counter and prescription, that have antihistamine effects. You want to stay away from those. And you look at the typical 70-year-old in this country, they may be in 10 or more medications. It could be that 3, 4, or 5 of them actually have antihistamine or anticholinergic effects. What you want to do is you want to get rid of those and replace, if you're going to need to replace them, or replace them with a drug that doesn't have the anticholinergic effects.
Yeah.
that is so interesting. I
Yeah.
Oh my gosh, like, I'm sitting here thinking about, the years and years and years, Terry and I, we worked for corrections as therapists, and one of the biggest big
Benadryl.
ticket items was Benadryl, and it was sold, and I sold it this way too, right before I
Mhm.
understood all this stuff. I got curious about it as, like, the holistic method for managing sleep, when all of those sleep aids that that the psychiatrist would prescribe for the inmates were not working. They would still struggle, or sleep isn't too bad, but I might need a little bit of work on it. I mean, there are years and years where I worked with people who every night were taking that Benadryl, and it was sold as something that
Was
is
good for you.
healthy. It's okay for
Yeah.
you. It's good for you. You're not taking trazodone. We're not throwing something with a PAM or a pan in there before bed. No, you take your Benadryl and you go sleeping at night. And just so to hear this idea that, like, it actually can be very bad for the body, for
Uh,
the neurotransmitters in the brain, for, like, oh my,
Well,
it's just
not just
a
for sleep, like, if you're taking this for allergies
as well.
daily,
So let's bring
same
it to
thing.
here we are talking inmates. Let's talk about general people who have
right,
allergies and take Benadryl every single day, for
right,
the
right.
seasonal allergies, which go all year long, by the way. Now it's every season.
Mhm.
Like,
Exactly. So
my
again, just to
God.
recap, I'm not saying don't use it in the acute.
No.
I've saved
We
people's
Yeah,
lives. Their tongue
yeah.
swelling.
Oh, yeah.
I'm giving them
Yes.
Benadryl, right? I mean,
Right.
if they
Yes.
can't breathe, they're not going to survive. But
Yeah, you
but
gotta
but the,
add your plug in there, Dr.
I
Josh. You're
know.
right,
yeah.
you should, just in
But
case. It's good. Yeah.
the flip side is, if you're taking a sleeping aid every single night, that's an anticholinergic
Mhm.
Benadryl type. Work with your doctor to get off of that, or find something that doesn't have that effect.
Yeah, and I would imagine I know there's a lot of research coming out on medications that increase risk for Alzheimer's and dementia, and it's one of these things where I say this a lot because my husband says that you can't get something for nothing. Um, so when you add something in, something else might happen, and I feel like there is such an acute awareness of Alzheimer's and dementia right now because of the increasing risk and rates. But I feel like there's also like this denial at the same time that the things that we're doing in our life are supporting the increased risk. So we're kind of denying it. We're just kind of, again, buckling down and waiting to see if it happens to me. But I also think about, because I am a woman in menopause, and the huge ideas of like, today, word retrieval loss and memory stuff and all this stuff. Like,
Right.
women are really getting scared in menopause because of the hormonal imbalances and things that impact your brain health and things like that. And I think that gives like this acute awareness that Alzheimer's could be a risk for you, when your brain becomes so fragile. I think like we begin to view it as fragile. It's been fragile the whole time, but until something happens, that fragility doesn't come into our conscious stream of awareness, until we're faced with something like menopause, for instance. Yeah. So do you have any thoughts on how to help brain health in general, especially with the aging brain, or a menopausal brain, or a hormonally healthy brain, right?
Yeah, so let's talk about Terry. I think that's a great point because first of all, Alzheimer's is more common in women than
Yeah.
men.
Yeah.
And if you look at the timing of Alzheimer's, it normally the numbers actually go up about 30 years after menopause. And I don't think that's in women. I don't think that's a coincidence.
Yeah.
So what I would say is, yeah, get with your physician who's open to bioidentical hormones. What
Yeah.
I found is that whatever organ of the body, brain, it doesn't matter what organ, you need optimal hormones, not just estrogen and progesterone.
Right.
You were talking about thyroid, we're talking
Mhm.
about adrenals. I mean, this is the hormones are normally a normally acting symphony, and
Mhm.
again, it's not. I don't think optimizing hormones is going to be the only thing you need to do
Right.
to prevent and reverse Alzheimer's, but it's a great first step.
Yeah.
Right.
Yeah. I do bioidentical hormone replacement. I love it. Changed my life,
Awesome.
even at this age. But yeah, so that's really great advice. Do you find that there is in your medical community, because I know that Jen and I get a little bit of pushback. Do you find that you get pushback in your own medical community on some of the ideas that you have or the knowledge that you have?
Yes, I definitely do, and it was a surprise initially. So last year I went to my Harvard Medical School reunion, and comparing notes with other of my alumni physicians, and they're like, "Oh, you recommend supplements? Therefore you're a non-traditional doctor." I'm like, "Oh, that's
Uh-oh.
not traditional. Okay,
Yeah.
whatever." I mean, I just want my patients to get better, and and
Right.
and watching what reversing
Oh.
Alzheimer's, doing IVs that are not traditional. So
Right.
so yeah, I've definitely seen that from my colleagues. I
Yeah.
guess I was surprised, but I also I understand because as physicians, normally we're kind of on this track. We're molded on this track where if you do something that's outside of what's considered the norm or the community of physician norm, you're going to get beat up by your local medical board, by your
Yeah.
hospital, etc. It puts
Yeah.
you at higher risk, and and frankly, physicians are often so busy that I mean, this isn't a good excuse, but too busy to try to keep up on the latest literature on
Yeah.
all this. And like we talked about earlier, you can't just take every journal article at face value. You have to look at where it's being funded, the history there. So yeah, I've definitely gotten pushback, but I don't care. I mean, what I care about is just getting people better and frankly, getting the word out. We had a summit last year, 30,000 attendees about reversing aging and Alzheimer's.
Wow.
And we had people all around the world. And that's why I love platforms like this that reach as many people as possible to let people know that, yes, there actually is a way to get your brain back and reverse Alzheimer's. And it's okay that there are people out there saying you can't do it. Let them do that and have an open mind. And I think the key point is that people should understand that there are options, and then they could choose or not choose to take them.
Right. I mean, Jen and I talk about this all the time, informed consent, right? So as part of informed consent, you need to know what your options are too, and the risk and benefit of those options as well. But the whole thing is an empowered patient, someone that is empowered enough to ask the other questions. And I wanted to say that it's interesting to me that nutrients are called alternative. Like, what in the world? Like, it's our only body fuel. And yet it's called alternative care. And it's like, it's a nutrient, it's a supplementation, it's something that our body needs. And yet it's alternative, you know?
Yep.
Right. I think just follow the money. There's a lot more money in patent medicines and expensive procedures than there is in selling you some organic broccoli.
Right.
It's true. No shade to the organic broccoli farming.
Yeah, but if we could patent broccoli, you would hear that as a new treatment. Yeah.
That's true.
That's when you're talking, I think a little bit, Terry and I have talked about like how we can prescribe, because some people seem to have this like comfort with the word prescribe. They have comfort within the we have a huge power differential within our roles, right? In our positions, right? And so people come to us as the expert, right? And so there's these buzzwords that seem to get people in the feels, right? And one of them is like prescribing, right? And so this idea of prescribing something nutritionally, or prescribing a lifestyle change, or prescribing a supplement. I mean, that's our love language here. Like when you say supplements, that I could geek out on them for forever because of what I've learned about them in the last 2 years of my life and how much they've changed my life. And it was done strategically. They weren't all just thrown at me, right? Like take this and this and this, right? It was done with assessments to determine whether or not there's contraindications for me taking some of these amino acids and supplements and foods and things. So I think about the word prescription, and you have this ability as a medical doctor, and here you are prescribing something that isn't necessarily always a medical prescription, a psychiatric prescription, a medical induced prescription. Like that to me is fascinating, because you with this title, you're like marrying these worlds, because you prescribe things that aren't medicine.
Exactly right. Yeah.
Or
in the modern Western standpoint, but
correct. And that's what we're so engulfed in here, right? Like that is what patients are so used to. I mean, and that's what they're used to hearing. So it's interesting how we have to bring buzzwords in for them to feel good, when we're actually, telling them, hey, go for a walk, start exercising a little bit more, stop drinking the alcohol, like put the salami down. Right? Like
exactly.
Jen and I have said that we need a prescription notepad that just says "go for a walk," and we sign it and hand it over like it's.
They do, but you say this well, Dr. Josh, on your website. Something that stood out to me is it said incremental positive changes that you can make to regain control over your own health. And it's more about you taking the time to learn all these things about yourself and actually have a model that's sustainable and that isn't causing harm to you, so that you can regain control over how you feel about yourself. Like that's just a very empowering statement, which I think is really neat that so kind of flows through all the things that you're talking about here today too. So
thanks, Jen.
Yeah. Well, we talk about all the time, like slow and steady often does win the race, except if you have a ticking time bomb on your hands, like Alzheimer's or dementia, like you're knee deep in that.
Yeah.
Then probably not so much. But now, when Jen and I talk about the 4 pillars, I usually say, pick one pillar, sleep, move, whatever, and get really good at that. Like make a lot of small changes in that pillar, then move on to the next pillar and make some changes in there and sprinkle the changes around until you can actually feel something a little bit better. Because a lot of people, especially for us in the mental health space, get very overwhelmed very quickly with lots of big changes. And so they'll drop out real fast.
Yeah.
And I would think that maybe maybe in your space, it's not the same, especially when you're dealing with Alzheimer's, because people are scared out of their minds, and family is afraid. So I would imagine that family is pretty important support with your clients, depending upon where they are. So there was one last thing I wanted to ask you about too, because I saw some information on just dehydration and Alzheimer's and dementia. Do you have any thoughts on that?
I mean, hydration in and of itself is important, but I also see the other side where people are drinking way too much water.
Ooh,
Um,
interesting.
in terms of, it is possible to overdo it. It is possible. I mean, if you're drinking gallons and gallons and gallons a day, to overdo it. So, one of the approaches is just drink when you're thirsty, and sure, if you're going to be out running and sweating, you're going to need much more water. But my favorite drink is actually water. Double distilled water as opposed to juices or
Right.
soft drinks. Stuff with added sugar.
Mhm. What is too much water? So
Yeah.
Jen and I have the only knowledge that I have of too much water is water intoxication
Right.
Yes.
from the prison. That's too much water is
Right.
when you can drink enough to
But
become
but I've
intoxicated.
definitely seen patients not from prisons, but from their doctors well-meaning to
Mhm.
say, make sure you have, a gallon of water a day, or something, and they overdo it, and their sodiums go low.
Sure.
Oh,
And
sure.
yeah, I mean, what I would say is, drink enough water so that your urine is clear. And if you're eating lots of fruits and whole vegetables that already have huge water content, if you just go eat, a large watermelon or something, you're not going to need to drink a lot of water with the watermelon. So that's the other thing, is like, if you're eating lots of processed foods, then yeah,
Sure.
you're probably going to need to drink a lot of water to try to flush out all the added sodium that's in
Okay.
there.
Oh, sure. Yeah.
So it's hard to give specific advice for the general public, but
Mhm.
all I can say is that my concern is sometimes people who are very well intentioned, and they're listening to the expert who's saying you have to drink this much water every. It's like sometimes they're overdoing it, and then we check their sodium level, and it's too low because of that water intoxication, and then you say, "Hey, back up."
Back off. Yeah.
That's interesting because to me, I just went like that's just an individual personalized approach to your healthcare, right? So all of these blanketed statements and blanketed approaches that you hear on social media or whatever don't always apply to you. Like people, if you're listening, it doesn't always apply to you, right? So again, getting curious about yourself and what you need and getting very in tune to your body and working with somebody who is willing to be individual with you
Right.
and not just give you the blanketed, eat less, move more, drink a gallon of water a day and you'll be good, that might not be the right approach for you. So it's very interesting. I loved this conversation a lot just because I think it was so relevant to brain health in general. And I think we need more of that. We need more attention to the brain as an organ. We've got heart doctors and stomach doctors and all these doctors. We don't really have a brain doctor outside of like, a seizures or, I mean, I know.
Yeah, I mean, they're definitely neurologists,
Yes, but not like the
yeah,
health of your brain,
that's
right?
true.
Like, there is neurologists, but I'm not
Yeah,
sure that they're looking at it the same way we are.
a little
You
bit
know
different. Yeah.
yeah, a little bit different. So, yeah, you're right, there's neurologists, whatever. Anyway,
I'm like, I
thanks,
don't know where you
Doctor
go with this,
Josh.
Terry. I mean, I can't help you here
I
because
need
there's
more omega-3 fatty acids
neurologists.
today. There is neurologists, but I mean and my mic is cutting me out because it doesn't want me to talk anymore. The average person doesn't go to a neurologist, though. The average person would go to a family doc or something.
True, and frankly, the average neurologist is spending a lot of their time dealing with severely ill
Right.
brains.
Yeah.
Right.
So I find that many neurologists, they're not focused on the wellness and prevention side.
Right.
They're focused on, and frankly, I think a lot of them are depressed because right now the traditional meds, they don't have a lot to offer. It's like,
Yeah.
if you
Yeah.
take this med, yeah, maybe you won't get worse. Like, okay,
I
yeah.
hope. Right, exactly. Well, if they're depressed, they can call us. We can help them out a little bit.
We do know what to do with that a little bit.
Slightly.
And before we wrap up, I just want to ask something, Josh. So 2 things. I have a question and a statement. My first statement is I think it's really cool that you are on here with us because I'm going to say this, and this is for myself. My words may not come out very right here, but like just you being on this podcast with us and Terry and I in our field and what we do and our degree of education, like there are stigmas being broken right here. Like just by you actually being on this podcast with us with our level of education, right? Like we are very different, right? But like there are and we are our professions are often very siloed.
True.
Okay. They're often so siloed. And yet, what is so intriguing to me is what we're talking about. Yes, you might be an expert in something, and Terry's an expert in something different, and I'm in something different, but there are so many common things that we are all crossing over in just like a 50-minute discussion here, which is crazy. So I want to say that because it just feels good to be part of something, because in professions of the past and places I've been, we were so siloed that people they just didn't play nice in the sandbox. And it might have been an ego thing. People were peacocking. And so you are breaking a lot of stigmas just by being here with us. So that I just want to say.
Well, the collaboration, right? So I think we talk a lot about collaborating with prescribers particularly, and there is a lot of pushback because people have been so I guess non-collaborative. Like they don't want the prescribers are the consumers feel like the prescribers might be against what their best needs are sometimes. So nobody wants to talk to them. Like, we villainize MDs a lot in this space sometimes. And so I think it's really cool when you can collaborate with somebody who's like, no, we can collaborate. We can, we can work as one. We can help people out in many facets of their life and not silo the care. And I love it. It's great.
Exactly. Yeah.
Mm-hmm. I
love it. So that leads me to my very last question before we wrap up. I just want to know, like, and for our listeners too, what is your favorite part of your job?
Ooh.
What is the coolest thing that you do that just gets you geeked up, that you just love? It gives you the most energy.
Oh, the coolest thing. It's easy. It's giving someone their brain and their life back. It's when the family says, "Wow." Like if someone has like a relatively new spouse, it's like, "Ooh, I'm seeing a side of this person I never met before." Yeah.
That's cool.
But basically giving someone their functional life back, you can't put a price on that.
I felt that when you said that. I felt that emotionally. So thank you so much for that. Yeah, I can tell. Yeah, I love that. All right. So moving away from that, I'm sorry to do this to you, but how can people get in touch with you?
Sure. It's easy. My website is drjosh.com, drjosh.com. And my email address is easy. It's drjosh, drjosh at drjosh.com.
All right. Thank you. And we'll also link your socials into our show notes for people as well.
Thank you so
we
much.
Absolutely will.
Right.
Thank you for coming on here today, Dr. Josh. We appreciate having you. And
this was a blast. Yeah.
All right. Thank you so much for listening, and we'll see you guys on the next episode.
Sounds good.
All right, we'll leave it running a little bit. Thank you so much. I could really tell that you had some emotional connection to your statement that you made. So I appreciate that a lot.
Thank you.
Yeah, no, this was a lot of fun. Thanks.
All right, cool. All right, so this episode should probably be on, I think, Jen, 2 weeks?
Yeah. I'm looking at I don't have it in front of me, but yes, it's either, actually, I do have it here. One moment. Sorry, my dog's distracting me. He's jumping up on me here. Yeah, so that will pop on the 7th. So May 7th.
Okay, great.
Is when it would come up. Yeah.
Okay.
We'll send you some stuff if you would please put it out on your socials. That would be great too.
I'll get my social media person to put it out.
Oh, you have a person.
I do. I need that. It's just
I know.
It's so much.
We understand. Like, a person too.
Yes, we do. Person. All right. Thank you so much, Josh.
Thank you, Josh.
Great seeing you in person. Yeah.
Yes, absolutely.
Nice to meet you.
Yep. Bye.